Nothemba is going to present pressure sores. So hopefully you guys haven't had breakfast yet, but I'm going to hand it straight over to Nothemba. And one last thing, please do not interrupt Nothemba's presentation. We'll ask questions at the end. And if you have some questions, just bring them into the chat. Over to you, Nothemba.
Okay, thank you, Jerry. Good morning, everyone. Can everyone hear me properly? My name is Nothemba. I'm the physiotherapist for the WBSA team. And then I only started with the team quite recently, actually 2019 recent. So the presentation that I'll be doing today is going to be on pressure sores and hygiene awareness. It does mostly look at the people that are frequent wheelchair users, but I will address all the other situations. If you guys have questions, you can feel free to ask. There's also quite a lot of medical terms that I try to break down. Some you can, some you can't. So if there's anything that you don't understand, just drop a message and then I'll explain it as well. Okay, so let's see. Can you guys see the presentation?
Yes, we can.
Sorry, there you go. Okay, so like I said, today I'll be doing a presentation on pressure sores, which are now called pressure injuries. So they recently reclassified them, but it basically still means the same thing, and hygiene awareness. Okay, so that's just the content that we'll be going through for today. So pressure injuries are, like I said, it's also known as a pressure ulcer, a pressure wound, or a pressure ulcer, most commonly known as a bed sore. And for wheelchair users, it's the most common complication that they experience. Basically, what it means is that an area of skin is damaged or underlying tissue is damaged due to pressure, friction, or shear forces, or a combination of all of those three. So it's usually a localized area over the bony areas. So your bony areas like around your knees, around your ankles, around the bum area. And what happens is the blood supply that supplies your skin and all the tissue surrounding it does not get there where it needs to be. So there's a disruption in the blood supply, and then it prevents all the oxygen and the nutrients from reaching those cells in that area, causing the cells to die. So kind of like if you don't have oxygen and you're not breathing, you will die. So that's the same way that our bodies function. It usually occurs over the bony areas where the pressure and the tissue distribution is the greatest. And then usually the areas that carry weight the most or bear weight the most when you're sitting. So like I said, with the wheelchair users, you're consistently sitting, or for those that are bed-bound, they're lying in bed for long periods of time. A deeper pressure can occur within an hour without any visible signs. So if you're sitting for an hour, you're already at risk of pressure sores if you don't do pressure care without seeing the signs of the pressure sore. And then from 3 to 9 days, then the pressure injuries start to be more visible. Okay. So I just got a few stats for us, and I use a basketball team so that it's more relatable. So in the 2012 Paralympic Games, they did a study with the national team, the guys and the girls with the Japanese team, on the basketball players and how much they're at risk of pressure sores. So in the guys team, showed that 45% of the guys teams show signs of low echoic lesions. It just means small size lesions over the weight-bearing areas. And then they did a similar study with the female team, and they also found that they had deep tissue injuries at about 68.2% of the players had deep tissue injuries. So based on the games that we watch, the guys tend to be more active than the girls, or they move around a lot more. So they're actually at a lower risk of getting them compared to the female teams. So the deep tissue injuries that are more frequent in players with your central nervous system, so that's usually your spinal cord injury, so that those that are wheelchair users permanently, even not during the sport. Okay. So like they said, the players using a wheelchair in daily life, which is 84.6%. So they're at a higher risk of getting them than those that use the wheelchair only for basketball. Okay. So there are 4 stages of pressure sores, and then there are 2 extra stages that have been recently added, and then I'll explain those later. Okay. And here's the warning that Jerry told you guys about. So if you are queasy, try and get some water. All right, so there are 4 stages of pressure sores. This is just a summary of the areas where they occur and the different stages. So the most common areas are behind your head, behind your shoulder blades, behind your sacrum or your bum area, the bum bones, the hip bones on the side, the knee areas inside and outside, the heels at the bottom, and then the bones on the side of your ankles. Those are the most common areas. And basically with each stage, it just depends on the extent that the tissue is damaged, right? And I'll go through those stages just now. So the first stage, stage 1, is non-blanchable. So what non-blanchable means is if you guys take your hands and in between your thumb and your finger and you press extremely hard, right? So what you should see is it turns white and then it turns red. So if you do that to an area that has a pressure sore and it doesn't turn white, that's what non-blanchable means. It means the blood doesn't move away. So that's when it turns white and it comes back and rushes back and then it turns red. So if you do that in a pressure sore area, it won't turn white because the skin cells there are dead. So the blood is actually stuck in that area, so it doesn't move away. And then so your stage 1, it usually occurs over the bony areas like every other pressure sore. And then it starts with a red or darkened discoloration. So for people with a darker skin, it usually is just a darker discoloration. And then people with a fairer skin, then you can see the red marks more easily. All right. So the area affected can usually have a different temperature from the surrounding area. So it's usually a bit warmer where you're affected than the surrounding tissues. And then you experience pain and firmness in that area. So stage 2 is where you have partial thickness skin loss. So this pressure sore is still very superficial, but then you're starting to see abrasions and blisters and shallow craters. Okay. So it's just a little less red, and then it starts looking more sloughy. 3, it's when it starts opening up, right? So that's, sorry, that's full thickness skin loss. So then there's damage or necrosis or death. Necrosis means death of the tissues. And then it may start now going down. So then you have the different layers of skin, the top layer, and then 3 different layers below. So as it goes down, it gets worse. So you start superficially with the first one. Then you have partial skin loss, so that's the first layer gone. And basically the full thickness that the second 2 layers start going away. And then it presents as a deep crater with or without necrosis. Sometimes there may be fat, but then you won't be able to see the bone. And then the muscle tissue might be there if it's superficial, if it's a superficial muscle, but then you won't be able to see the deeper muscles. All right. And then stage 4 is when there's complete loss. So there's full thickness. So all the skin is gone. And now you're starting to see the bone and you're starting to see the deeper tissue muscles. And there's tissue death that extends down all those structures. So then you see your tendons, you start to see your bones, and you may have eschar. So eschar is basically like a darkened spot within that area because of that you can see the necrosis or the death of the tissue. So the whole skin layer now is penetrated. Okay, and then the other 2, I just don't have them on the slide here. I added them a bit later. So you can also get deep tissue injuries. So there's a 5th one with deep tissue injuries. It just means much deeper than this, and it starts affecting the deeper muscle tissues. And then the last one is called an unstageable pressure sore, where you've lost so much skin tissue and you've lost so much muscle tissue that it's basically a hole in that area, and then you can get some eschar, which is some burnt areas. Okay. All right. So there are 3 main causes of pressure injuries, and that's usually pressure in time, friction, and the most common one is actually shear forces. So pressure in time is the surface pressure experienced is determined by the weight, the size, and the duration of the pressure over that area. So for the bigger people and the heavier boned people, they are at higher risk. But at the same time, if you're skinny with no tissue to protect you, so you don't have that layer of tissue to protect you, you are still at risk as well. So your weight, it depends on how bad it is. Is it big or is it very small and not in between? So direct pressure on the skin, so again, especially over the bony areas, you decrease the blood supply to that area, and then you have swelling, cell death, and then a pressure sore. Friction is by rubbing against surfaces. So the most common one is your transfer technique. So even when you're transferring from your wheelchair to a wheelchair basketball wheelchair, that's if you scrape your bum against the wheels while you're going across, that is a pressure risk. And then the last one refers to shear forces. So that means when the skin tissue moves parallel to the supporting surfaces or the bony structures, and then there's pressure being applied. So basically what that means is if I'm sitting on my bum, like you all are right now, right? So let's say this is my bum, and this is the bone that's in my bum. Basically, it's an inside force. That's why it's the most dangerous one and the most common one. It's the inside force. So when you're sitting like this, and then you just shift like that, this is what's happening, all right? So for those of us that can't feel, it's easy to shift, like I'm tired now, I can move. Then the blood supply moves. But for those that can't, all they're doing is they're not shifting, but they're still moving their bum areas around without relieving the pressure. So this keeps happening, and then the pressure sore actually starts from the inside going out. So you're basically digging a hole out into the skin, okay? Yeah. So these are the risk factors and the complications of pressure injuries. So your external factors would be heat, moisture and sweat, trauma, so if you bump yourself on anything, medication, smoking, and alcohol or substance abuse. So external factors just means things that affect you from the environment. I think that's the easiest way to explain it. Outside of your internal body, surrounding environment. Your internal factors, so that's more related to your body itself. It's immobility, also you're not moving around enough. Poor nutritional status, you have poor skin integrity, which I'll explain a bit more later. Incontinence, sorry, sensory impairments, obesity or being underweight, the presence of comorbidities. So comorbidities are, we usually say other medical conditions, so like your diabetes, your high blood pressure, something like that. And then loss of muscle bulk or muscle atrophy from inactivity. All right. So when it comes to treatment, so you look at all those factors that we just looked at. When it comes to treatment, you actually want to start with prevention so that you don't get to treatment, right? So that's how we say prevention is key. If you stop it from happening, it's not going to happen, then you don't require the treatment. Okay. So when you're looking at prevention, so the most common prevention stuff is your pressure care cushion. So for the people that are wheelchair users on a daily basis, your cushion is very important. Okay. Sitting upright in your chair, so no leaning like it's a Golf 1 driving, no weird. Every time you need to sit in your chair, you actually need to be optimally positioned so that your cushion can do what it needs to do for your bum area so that you don't get the sores. Your pressure relief techniques, adequate nutrition, that is good for skin integrity, maintaining it. Friction and injury prevention, so bumping yourself and not transferring properly. Avoid moisture, and I'll go more into detail with that. Do a daily skin inspection. So every morning, like I always tell my patients, every morning, if you're a wheelchair user, during the day, every morning when you wake up, before or after you get showered, check your skin, check all the common areas, check your head, shoulders, the whole body, inspect for anything, whether you cut yourself, whether you scrape yourself on something, any pressure sore areas. It's the easiest time to check is when you're getting dressed in the morning. And then again at night, when you change from clothes to pajamas or you're going to take a shower, you're doing another skin check. So it should be twice a day. All right. And then positioning yourself in your wheelchair in your bed. So those are the things that you really need to do just to stop yourself from getting a pressure sore. If it does happen that now you do have a pressure sore from whatever happened, and if it's a stage 1, so like I said, a stage 1 you can treat at home because all it means is just that you have some red in that area that's affected or some discoloration. We can still save the area before you have to go to a clinic or a hospital. So what you do is, if it's a stage 1, you can see, okay, you did a skin check, and here on my knee, I have a red area. All you need to do is you stay off that area. So nothing must be touching that area. You can massage it with ice around the area just to reduce the swelling. And then you find and address the cause, okay? So maybe the reason you have a pressure sore on your knee is because you're sitting in your chair, but your knees are against the wheelchair bars on the side, and that's a pressure area. So then the way that you sit, pull your knees together and make sure that you're sitting optimally. All right. So find and address whatever's causing that pressure sore. And then you check and then revise your pressure relief techniques. Usually covering the area works. There's also get some gauze, the normal gauze with normal saline or water, and you cover that area, stay off the area for a couple of days. It should clear up immediately. If it happens that it's a stage 2 to a 4, then you seek medical attention, okay? Because now it's starting to open up, the skin is breaking. So then at the clinic, you go to your clinic. If it is bad or worse than they thought, then they will refer you to a hospital. But at the clinic, then they would give you the hydrocolloid dressings or they clean the wound for you and then they dress it for you. They can give you antiseptics or antibiotics depending on how bad it is. If it is really bad and they send you to a hospital, some people require a skin flap. So they keep you on bed rest. And if they see that it's not closing on its own, then you need to flap. So basically they take skin from another area and then they put it on the affected area and then the skin grows from there just to close that hole. So we don't want you to get to a 2 and a 4, especially a 4. Okay. And then just to go back to before I move forward, yeah. The pressure care cushion. So for those players that are using wheelchairs daily, please make sure that you check your cushion and you have your wheelchair maintained at least once a year. Okay. So I know with especially the public hospitals, they don't know how to seat people. And chances are you're going to get a pressure sore at home more than you would get it at basketball. Okay. So you must always make sure that your cushion, you get a new cushion every year. You maintain your cushion, so it mustn't be wet, it mustn't be dense. They need to maintain it and you're seated properly. So what I will do if I do get a chance to see the team is I'll start checking your wheelchairs and start checking your cushions to make sure that what you're sitting on most hours of the day is actually optimal for you compared to the pressure sore that you would get, which is highly unlikely on a wheelchair basketball chair. All right. So these are the pressure relief techniques. So this is the easiest way to avoid a pressure sore, all right? These are the most common ones. So leaning forward is the easiest one. So basically all you do is you lean forward and you touch your toes and you stay there for 2 minutes. So pressure care, you're supposed to do it every half hour for 2 minutes. So every 30 minutes, you're supposed to do pressure care for 2 minutes, okay? Even as an abled person, I can feel now, I've been sitting for a while, you can see I'm moving around, I can shift, and it's been less than 30 minutes already, okay? So for the wheelchair users, same thing applies. Every 30 minutes, for 2 minutes, you need to do pressure care. So either you lean forward, the most common one. Some people prefer to push up on their chair, but then your upper body strength needs to be really good to stay there for 2 minutes. And then if you're lazy, you can do one bum at a time leaning sideways, so 1 minute on one side, and then 1 minute on the other side, okay? All right, and then we're gonna move on to hygiene awareness, just to make sure, yeah, okay. So hygiene awareness, so hygiene, what are we talking about hygiene is, it refers to the conditions and practices that help us to maintain our health and to stop the spread of diseases, okay? Personal hygiene then refers to you maintaining your own body cleanliness. Therefore, hygiene awareness is us being mindful about the practices that we do in order to stop ourselves from getting any infectional diseases or pressure sores, I guess, right? And the biggest thing with hygiene awareness, and that also relates to our team, is continence versus incontinence. So continence is the ability to control your bladder and bowel. So are you able to feel when you need to go to the bathroom, whether that's number 1 or number 2, and are you able to hold it until you get to the toilet, all right? For those that can't feel, how are you maintaining it? How are you making sure that you're not sitting in a chair and you're sitting in a puddle of wet cushion, all right? So that's when you have incontinence. So those for the incontinent people, it's an involuntary loss. So it's not in your control. It's an involuntary loss of your bladder and your bowel control. Okay. And the reason I just chose the bladder and the bowel program because it's the most common cause of your pressure sores. So there are other stuff in terms of hygiene awareness. There are other stuff, but the most common cause is your continence. Okay. So for those that are, again, wheelchair users on a daily basis, you have your people that like your spinal cord injuries, or they can have other injuries that cause them to not have bladder and bowel function. All right. So then what happens is, if you can't feel and you can't hold, how are you maintaining your bladder, firstly? So sometimes then it's either they put you on a bladder program, or you have a catheter on, or if you're functioning normally, you can void normally, so you can go to the bathroom normally, and you just need to make sure that you're cleaning properly and you do your basics and washing your hands when you're done, or before and after, depending on how strict you are. All right. So for those that are on a bladder program, it is important that the program that you establish while you're in rehab, while you're in a hospital, you stick to it. If you are going to change it, please change it under the supervision of your treatment, of your medical team and your treatment regime. So what a bladder program is, they do an X-ray or a UDS, a urodynamic study. They test what type of bladder that you have, and hence what type of program you should have. So you can have intermittent catheterization. So it means every 3 hours you put in a catheter, you drain all the pee out, and then you take it out, and then you don't have to carry a catheter bag around with you. Okay, but then you need to do it 3 hourly. So there's a schedule. So either you do it 2 hourly, every 2 hours, or every 3 hours. You need to be emptying your bladder. But it's convenient in the sense that you don't have a bag around your leg. Okay. Other people go on a condom catheter, which is basically a catheter. It's only used for males. So it's a catheter that goes over the genital area, empties, and then they empty it out. And then the last one is your normal catheter, which is the pipe that sticks and then stays around your leg. Okay. So for the people that use catheters, it is important that your timing, if you're on a bladder program, so like I said, it's strict 2 hourly or 3 hourly. If you don't, you're going to leak. Okay, and then again, you have a puddle of wetness on your cushion, right? So your timing and your amount of fluid that you consume needs to be monitored. So if the doctor says you can only drink 150 mils every 3 hours, please drink 150 mils of water every 3 hours. There's a reason they have that set standard, because it means your bladder can only take 150 mils every 3 hours before you need to empty it again. All right. Caffeine and alcohol consumption needs to be limited, because it makes your bladder sensitive. So if you take coffee in the morning, you need to limit your coffee intake, because then it means you might need to go to the bathroom sooner than you thought, and then again you leak. All right. And then the scheduling of the bladder emptying, I've already went through. If you don't do your program correctly, or if you don't clean your catheter correctly, or you don't empty out your bladder correctly, then you're at a risk of getting a bladder infection, or a UTI, which is a urinary tract infection, or if it gets worse, you can get bladder and kidney stones or damage and failure to your kidneys, and then you're admitted into hospitals. Okay. And then I know for some people, they prefer using the adult diapers, which is also okay if you can manage it properly. So remember, if you're using a diaper, at some point it gets full or wet, you can't keep the same diaper for the whole day, because you are literally sitting in a pool of your own pee, which again, it's a moist area, it's full of liquid and water, plus you're sweating and you're in the chair, and that causes your skin to break down, and it is a risk for pressure sores. So if you're using adult diapers, you need to change them frequently, more frequently probably than catheterization. So if you know you've been playing a game for 2 hours, immediately, even if it means you didn't use it, you are sweating, you're wet, your skin is wet, you need to change immediately and dry off the skin. Because what you do is you break down the integrity of the skin, and then what happens is then the pressure area starts forming in that area. All right. And then, and then if you're on medication and Botox injections to help relax the bladder, that's another regime that they use. You just make sure that you stick to your schedule. Those that are normal voiders, just go to the bathroom as you usually do. Okay, it shouldn't be a problem. Secondly, it's your bowel routine. So again, it's the same thing with the bladder, so this should be a bit shorter. Your bowel routine, for those that can't feel and can't use the bathroom frequently, they need to get on a routine, okay? So the routine is done every second day. So it's not as bad as your bladder that you do every 3 hours. Usually the most common routine is done every second day or every day, depending on your medication. So what they do is you take medication in the morning, That's going to help you bulk up all the contents of your stomach. And then that's usually your Senecots. And then at whatever scheduled time that you have. So some people, they bulk up at 6 a.m. and then 2 p.m. they know that they need to be in the bathroom. You take your Senecots 15 to 30 minutes before the time, and then it cleans your whole entire stomach contents. And that whole process usually lasts an hour. Okay. So for those that are strong, they know, okay, at 2 o'clock, my stomach is going to go. So I take my pills at 1:30, 1:45, or 1:30. I'm already on the toilet and I'm waiting. Okay. And then it clears out the stomach. So again, if you stick to that program that you've already established, it should help you go about your day. So if you know, okay, today I have a game at 2, all right? Maybe then I can't play that game because that's my bowel time or whatever. If I have a game at 10, then I should be safe, right? So I can take my Senecots at this time, my stomach will go at that time. If I do have a game at 2, I want to start my Senecots early, a bit later, start your Senecots a bit later, then your bowel goes at 8 p.m. Then you don't need to leak during a game or anything. So it's all about management. But again, it's a routine. Once you've established it, you need to stick to the schedule. And if you change it, it usually takes about roughly 2 weeks for your body to regulate back to the new routine. Okay, so it depends on your lifestyle as well. When do you need to be in the bathroom? When are you okay to be in public with people without being scared that you're gonna mess on yourself? Okay, so yeah, so the Senecots and your Thobela are the normal ones. I use Movicol with the players because it's just when you guys are feeling constipated and you feel like you haven't been to the bathroom, it really helps to clear the stomach up quickly, and then you need to restart your bowel program again after that. You can't depend on Movicol; they don't work the same as Senecots and Thobela. Um, and then again, for the people that are using diapers, it's about hygiene. You need to change immediately when you see that something is happening. Same principle. You don't want to sit in moisture and you don't want to sit in fecal matter for a long period of time, especially if you're sitting in your own feces. It actually burns, which is even worse. So now you're burning and you can't feel it and you're sitting on it for hours, then you're at a risk of getting not only a pressure sore, but because you're sitting on the fecal matter, it's actually going to cause an infection as well. So you're sitting on your own feces and then cause an infection, and that's a much bigger problem. All right. So everyone has their own bowel program. You should all have an established one. If you don't and you're interested, then you can just send me a message or ask me questions about it and I'll explain it. They are complicated, they are time consuming, but it's the only way you can be in public without having to feel ashamed or scared or worried or paranoid the whole time, because you know your schedule, you know when you can, when you need to be at what time, right? So if you don't stick them to your routine, what happens? So what happens is it's either then you get a UTI or you're incontinent and you're leaking. So you can either have bladder leaking or bowel leaking, both of them count. Kidney and bladder stones, you can have kidney failure, bowel impaction. So bowel impaction just means it's like when you're constipated, basically. But then even with the medication that you take, it's still stuck there and it's just not getting out. So what they do is then they usually have to go to the hospital and they do a bomb or a flush and they just basically release everything. You can also get constipation or diarrhea, and like I said, fecal incontinence, or otherwise you can get hemorrhoids. Okay. So then what do you do? So the first thing is stick to your routine. That's the easiest thing. Stick to your routine. If you're going to change it, and then make sure you stick to it so that in about 2 weeks you regulate it to the new routine. That's okay. Wash your hands before and after every bowel and bladder routine that you do, especially for wheelchair users. You've been pushing your chair the whole day, touching everything and everywhere, and then you come and you want to change your catheter with the same hands. You're going to be at a risk of infection. Okay, change your routine. Stick to your routine. Wash your hands before and after any bowel and bladder actions. Wear gloves if you're managing your bladder or your bowel, or even the wounds as well, your pressure wounds. Always wear gloves. Wash your hands before. Put on the gloves. Do what you need to do. Throw the gloves away. Please dispose of them not in your common dustbin. You need to double bag them and put them in the red plastics. They should provide you with those. And then you wash your hands often. Regular sanitization of your wheelchair, especially now with COVID. Please make sure that you take care of your cushions that you sit on daily. So if you wet your cushion, most people have your waterproof covers for their cushions, okay? So your waterproof cover, you take out the cover, it's wet, you wash it with cool water, and you air dry it. You don't sun dry it, you air dry it, okay? Not directly in sun because then the elasticity goes off. You air dry it, and while the cover is recovering, you should either have a second cushion, cover to put on, or you put a linen sieve on top of your cushion to preserve your cushion. Okay, you don't want your cushion to get wet. If it does get wet, you wipe it down with a damp cloth, not wet water, and you also air dry it and let it dry so it can still puff up. All right. Regular showers before and after game. So you guys, again, you're sweating a lot. Heat and moisture. Remember, just if you don't remember anything, heat and moisture destroy your skin faster than anything. So please, before and after game, due to the excessive sweating and the moisture buildup, make sure that you take a shower, that you preserve your skin integrity, and then you dry up and put on your lotions. Adult diapers, please check them daily and change them on a regular basis as well. Your regular skin checks twice a day, morning and evening, it's more convenient for you guys. Your regular checkups with your medical team, at least once a year you should have a checkup. And then maintaining good diet and the nutrition, and then you must please keep hydrated. If you're on a bladder program, keep hydrated within your limits. All right. And then lastly, I just added some COVID-19 tips for your wheelchair users. Please, again, clean hands. So your tires can transfer the virus to your hands when you're pushing. Okay, so then you need to wash your hands and you need to sanitize 60% more sanitizer for you guys because of the wheelchair pushing. Please wipe down your chairs. Okay, so you're pushing your chair through all different types of surfaces and bumping it. At the end of the day, wipe down your chair, or in the morning. Or in the morning, you sanitize your chair, okay, and then you can go out. And then, as usual, wear your mask and social distance. And then just remember, if you're sitting in a wheelchair, you're much lower than the average person, so you're at a risk of catching droplets from the top. Okay, so then your distance is about 1.8 meters from people, social distancing. And yeah, so if you don't remember anything at all, just remember prevention and protection. Do your pressure care and position yourself when you're sleeping, and make sure that you're always clean in anything that you do, in any bowel or bladder or sweating or anything that you do. All right. And then your pressure care, 2 minutes every 30 minutes is worth more than being stuck in the hospital for a year, which is on average about 1 point something million to stay in the hospital to manage a pressure wound. Okay. And then wash your hands regularly. And yeah, guys, keep safe and fit. And I think that's everything. Thank you.
Wow, Nothemba, thank you very, very much. That was a very informative presentation. I know I learned quite a bit just from watching that. Let's open it up now to some questions from the guys. I know it's you guys mustn't be shy to ask questions. It's might not be a topic that you necessarily want to talk. So if you don't want to ask questions, and that, as Nothemba said, she will certainly talk to you one-on-one. But yeah, let's open it up to questions.
Yeah, I just want to say, Nothemba, thank you very, very much. This has been a topic that has plagued wheelchair basketball for many, many years. And your presentation really and truly put facts into perspective. Just two players that come to mind straight away, and that was Carl Bowles and Fahima Beckles, that have suffered tremendously for over 1.5 years with pressure sores and been hospitalized for this period of time as well, where we had Fahima that nearly lost her life as a result of it. So absolutely, everything that you have put forward there, everything that you've explained, just shows quite clearly prevention is better than cure. Thank you once again. A wonderful, wonderful presentation.
Thank you. Any questions?
Yeah, guys, any questions? Let's not be shy. Now's the time to find pick Nothemba's brain. She's got a very big brain there by the looks of it. So let's get her to help you guys out. Anybody?
Nothemba.
Hello.
Okay, my question to you is, I see that it makes me scary when I look at this, especially for people sitting in a wheelchair. My question to you is that a person that is in a wheelchair drinks a lot and doesn't care about about his bladder. And at the end of the day, when he or she find out that something is wrong, and you said that you must monitor the drinks or the caffeine that you have drink. So what is the message that I sent to the guys at my club and told them this is what you have to do?
Are you asking me what is the message that you send to them?
Yeah, yeah.
Oh, okay.
Especially,
So,
yeah.
Yeah, yes.
That's okay, go.
Okay, so like I said, with every player, their bladders are not the same. So that's why they do the urodynamic study to check what type of bladder and how sensitive it is. So for those that are drinking your coffee and even your cool drinks, your fizzy drinks, your Coke, anything with caffeine, anything with alcohol in it, the doctor usually tells them how they need to manage it. So that's something they should actually know from when they came from hospital, when they sustained the injury. Okay. So I can't really say you can have 1 cup of coffee in a day, or you can have 2 cups of coffee, because your bladder sensitivity is based on the results that you got. So you should actually know that. And if you don't, that's why you need to do your medical checkups. So they just need to manage it. So if let's say maybe I drink this weekend and I drink 2 cups of coffee, and then my bladder leaks. So then tomorrow, let me try and drink 1 cup of coffee and see. All right. And then also look how you balance your caffeine intake and your water intake, right? So if I have my 1 cup of coffee and then maybe I drink quite a bit of water, all right, then it's almost like you're not drowning it out, but you're managing those caffeine levels and the irritability of your bladder. But then the problem comes is, what if I take too much water? So you see what I mean about balance. So they need to know, if I'm a coffee drinker and I drink 3, I know that my bladder will leak in about 2 hours. But if I have 1 cup of coffee, then I can stay the 3 hours and then I can empty the bladder. Okay. And when they empty the bladder, they also need to keep an eye on how much am I emptying. So they need to actually measure that. So that's what they need to teach you that during your rehab process or during your hospitalization process. Okay, that's something that by the time you leave, you need to know. And if you don't know, go and find out. Okay, so you measure how much am I, if I had 1 liter of water at between 8 to 9 and a cup of coffee, and then I count how much milliliters that is. So 8, 9, 10, 11, I need to do my catheterization. Am I leaking? No. So then maybe it's okay if I do it that way. If you are leaking in 2 hours, that means there was a problem. You took too much. Okay. So you need to, you kind of need to monitor every 3 hours. How much am I taking out versus how much am I putting in? And how much am I putting in? Was it just only water, or is it something that's going to irritate my bladder, make it more sensitive? Does that make sense?
Yes, thank you, Nothemba. I note that. Thank you very much.
Okay.
Nothemba, just something I saw.
Hello. Question.
Just one sec, Mr.
Yes, good. I got a question, man. What can we do to prevent it? Like, I know what they say now, you must move around, but I remember when being in hospital, one of the ladies told me I must put on PrEP. And in front for 13 years, now for the last 13 years, I'm using PrEP. And I think it's like, I believe in that. If I don't put that on, it's, so I just wanted to know, is it like a true story to put PrEP to prevent it or what? And then I also would like to know, because I had it on my heel. So I wanted to know, what do you use, like a certain ointment? What ointment is really good? Because the black ointment that they gave, it didn't work. For me, it took very, very long to heal. Okay, thank
How
you.
How bad was the pressure sore?
It wasn't really bad, but it was of the heel because of the shoes that was too tight. Now, you must can't feel it.
Yeah. Okay, so the PrEP is, I think, is what they use when you have a very small pressure. I think it's the pink dressing that they put over. So I can't tell you what to use in terms of medication. So your doctor should be able to tell you that, because again, like you said, they gave you the black one and it took too long. So you're not responding to it as well as if you had something else. So they need to trial and error that. What do you use to prevent your pressure? Okay. There is no one recipe for it. Everybody's body is different. So they need to trial and error which one works for you and which dressing is going to work for you. Okay. And if you see that maybe the job that they're doing, they go to another clinic and find out from somebody else, or go to a person who, the most best people to go to are actually your wound sisters, not any normal nursing staff. Okay. People that are trained in wounds, that their job is dealing with wounds. Those are the better people to address in terms of what to use. Okay. And then one thing I want you, are you using a wheelchair daily?
Yes, yes, I'm wheelchair bound.
I need you to take a look at your chair. So if you have pressure sores on your heels, what is it on your chair that is causing them? So I'm not sure.
No,
The thing is, yeah.
it was my techies. The techies that was too tight. The heels was the techies.
So the tackies were too tight for you.
Yes.
And then did you change that?
Yes, I did. No, it's fine now, but it's like what I've noticed every time I get a new pair of shoes, it happens now. So it's like a thing that takes place every time. It look heel, but if I must wear now a shoe, then I will see here's a blister starting to come again now, but it's the same spot, and it leaves this black ugly mark that is like staying there now.
Yeah. So then one shoe, we always say one shoe size bigger than your normal shoe size. The reason we say that is because you are sitting the whole day, your feet are going downwards, you will always have swelling. Okay. So to accommodate the swelling that you have, you need to go one shoe size bigger. All right. So if you're a size 6 and you buy new shoes and they're a size 6, and then you're sitting the whole day in your chair and you get swelling already by stretching the skin, it's already compromised. Then you put on your size 6 shoe, now you're making it more tight. Then you're at a higher risk of that. And that's why you're getting those frequent pressure sores. So compensate for the fact that your feet are swelling because you're sitting the whole day and you're not moving, or you're not moving the legs rather. And then always go one shoe size bigger, 2 if you need to. If your swelling is really bad, two shoe size bigger, and maintain that. Even your socks. Are you wearing the really tight socks that they're leaving? If you take off your socks and there's a line there, then those socks get bigger socks. Bigger socks, bigger shoes, compensate for your swelling that you're going to have because you're in your chair the whole time. And then manage your swelling. So at the end of the day, put your feet up. When you position yourself when you're lying in bed, put your feet up. Do your stretches, pump the ankle so that the blood goes down. Try that and then see how you're sitting in your chair and see if that helps.
Okay, thank you very much.
Sure.
Thank you.
Natalie, you've got a question?
Hi, Judy. Yes, hi, everybody. I have a question. Being a player and the coach at this point in time, my concern is dehydration. When I was playing, you obviously using so much energy and you're sweating and everything. So your water intake is a little bit more. However, what I have noticed with some players is that when they are dehydrated, they won't even urinate at that particular time because they're not even having water, even though because they are practicing and sweating and all of that. What can be done in that instance? You don't want to give them too much water neither while they are training, and also too little at the same time.
So what we can do is...
That's my concern.
Sorry, can whoever... Miska, can you mute your mic, please? Thank you.
Okay, so you must remember that with the players, the amount of water they drink, like you said, they are sweating out. So we kind of need to find a balance between that. So maybe we can find a general standard that we can work with, or each player can, like I said, you have to monitor yourself. You have to monitor yourself. So if, let's say, you're going to practice for 2 hours.
Miska, please, your mic.
Okay.
Thank you.
If you're going to practice for 2 hours, then let's try a liter of water in the first hour, a liter of water in the second hour. All right. And remember, it also depends on what you're doing. Are we doing endurance today? Are we doing cardio today? You're more likely to sweat more. Are we doing shooting today? You're more likely to sweat a little bit less. Does that make sense? So you need to say, maybe on the cardio endurance day, let's do 2 liters of water by the end of the session to compensate for all the sweating. So it will compromise your bladder routine in terms of how much you need to take out, or how much is coming out, or maybe something is not coming out at all, right? So you still need to do your check. And if, let's say, they do have, so it's 2 hours of practice and you're sweating and you're moving, so that's fine, you're still moving around, you're still active, and they do have a leak, then that's where your cleanliness will have to come in. All right, so you've been sweating already, so you should be taking a shower, and then you're just maintaining that bladder program, okay? So I can't give you exactly, like I can't say maybe Dineo must take 2 liters of water and then Linda takes 3, because I don't know how much they're sweating. I don't know how much they're processing. Their metabolic processes, I can't monitor that through and through, okay? So you can have a set standard. If I'm doing, so guys, if we're doing cardio today, let's do this much water. And the one thing I've noticed with our players is they actually don't drink water, okay? So we solved a lot of the headaches, a lot of the tiredness by just drinking water and pumping them with electrolytes and no medication. So I did a lot with the ladies team in Angola. We barely used any medication for any pains because they were dehydrated. They don't take water, so you guys really, really need to drink your water. And they don't drink their NHAs or whatever electrolyte solution that we have for them, okay? So we've been trying to push that because of the dehydration. It's because they actually don't hydrate enough, okay? So the bottles are still this full. There's not even half a bottle, and they're sweating the whole time, all right? So we had to look at it and we can decide, okay, if it's cardio, let's do this much, see how it works. So everything is trial and error, especially because it's a sport. Trial and error, have like almost like a set standard, and then we can take it from there.
So, Nothemba, in terms of face masks, is there any threat there for pressure sores?
Not really, no.
Okay.
Because you can, you must remember our players are usually, your levels are down. So like your T's, so like T4 maybe, and on downwards. So your pressure areas are in areas that can't feel, I don't want to say can't move, but with impaired sensation is the most important thing. Impaired sensation, or you can't feel at all. And then I guess if you can't move. So like Jerry, you've been sitting now for how many minutes? 48 minutes. And how many times have you moved up and down?
A lot.
Right, in your chair. Exactly. That's because you can feel. That's
Yes.
why for them, so on your face, you can feel your face. Unless you're a quad, you should be able to feel, even a quad can feel your face.
Yeah.
So then it's really not a risk.
All right, cool.
Just a point that was raised now as well on the high performance line from Billy is the type of clothing that one wears. Will that also affect pressure sores?
Yes. So if you wear tight clothing, you need to be a bit more careful with your pressure care, because it is an area of pressure. So like your skinny jeans and your something that's not breathable. If it's not breathable and it's tight, it is a risk for pressure areas, yes.
And clothing that have got seams in it that run across the backside?
If yes, those can. So it comes with your seating. So when you position yourself, when you're sitting in your chair, you actually need to fix quite a bit. All right. So the creases that form at the back of your t-shirt or the seams at the back. But again, if you're doing your pressure care, it's almost like a relief from those seams as well. So if it's loose fitting, but you're doing your pressure care, it is relief from the seams if it's not stuck to your skin. Okay, so the use of the clothing, even with the seams, and it should be okay. It should be manageable with pressure relief.
All right, thank you very much. Appreciate it.
All right, guys.
Just one question.
Yeah, go, Max.
Material, fabric material, i.e. nylons and polyesters, where they've got the slip and slide factor on them. Will that also affect them? Because they can, obviously it's friction. Or should they wear cotton?
You should, again, I think it's the same principle with the seam story. It should be manageable with your pressure relief. Because I know what you mean. Are you talking about those shear forces that I was talking about, or the frictional forces on the outside?
Yeah, it's the friction on the outside. Like say if they're wearing a nylon or a polyester, it's a very sort of smooth type material.
Yeah.
And while they're moving around, they're getting friction on the skin.
Yeah. So
cotton, you won't get it so much.
So it should be manageable with your pressure relief as well. But if you are a more, I want to say smaller person, then I'd limit how much you wear it, because then your soft tissue protection. So remember, you also still have soft tissue protection. So if I'm small here, I still have like a bit of fat. That's, yeah, it's basically the fatty areas that are padding. We still have natural body padding, right? But for your very skinny, tiny people, they do need to be careful of that friction, yes. But you still have your padding from the fat that's around that bone area. So that should take care of those small frictions. And then that's with your pressure care, plus you're transferring. When you're transferring, you're moving around, then it should be okay. But if you're a really tiny, bony person, be more aware of them.
All right.
So
The other thing with
Yes.
electrolytes is that you take that during the game, or should you be taking it after the game?
After and during. You can't take it during as well. To boost, like a booster during, and then after the game, just to replace them that are lost.
Okay, so then there's 2 questions. Let me just mute here quickly. Hold on. Okay, sorry about that. Just to tell 2 questions. We did a lot of research in the early years of wheelchair basketball on the type of uniform that we actually purchased. And eventually we met a particular fabric, or we should say we identified a particular fabric, which was a moisture management fabric. And this seemed to reduce the pressure sores completely, rather than using the old nylon kits as what Max had been referring to. So yes, I found that this is the way that it did help us, and it did help the players in reduction, especially the long flights that were 16, 17-hour flights, and the players that were wearing a particular type of clothing on the aeroplanes. And the fact is that we did look at moisture management to assist, so there was just a bit of a point of interest.
Yeah.
Secondly, the use of Red Bulls and Dragon and all of this type of stuff, which I see a lot of players normally drink 3 or 4 before they start the game. How does this affect one when it comes to the pressure sores?
It's a caffeine situation with your, I think Letabo maybe can help me a little bit with the Red Bulls. He might know a bit more, but I think it all comes down to your caffeine consumption, which will cause you'll have the energy that you need, but then you're gonna burn out completely. So then it's almost like keeping a balanced diet. They need to manage that if it helps them, and then see how their body responds to that. Because then if you're unhealthy, or if you have a lot of consuming a lot of that caffeine, then it will build up eventually. Yes. So it's not going to be, it won't have an immediate effect, but eventually it will build up. So let's say maybe they're on tour and they take a lot of the dragons and they're eating pap and. So then nutritionally, they're not providing their body with what they need. And what it does is then it causes, again, it also does come down to your skin integrity. So your skin is not nourished enough, or it's not getting enough vitamins or nutrition to it. So then it does pose a risk. Okay, so you can't really, I guess you can't really stop them completely from taking it, but we can monitor it, especially during games. Something that we can keep an eye on. But we prefer the older method of your electrolytes rather than your boosters. Because those are boosters, they boost you for then and then you drop significantly after. So they have a long-term effect, yes, if you don't manage them properly.
Okay, thanks, Nothemba. Anybody else got anything? Natalie, I saw your hand go up again. Was that the old one, or you've got another question? No.
Hi, Jerry. Nothemba, this is my last question. Jerry like to knock me when I ask question, and I like to ask simple question. Is when a player is coming to court, and that is what I picked up. They come to court, they get out of the chairs into the playing chairs. But on the wheelchair, I can smell the urine on the chairs or on the cushion. And then when he gets into the chair, now he plays, you get out of that chair. Now that smell is still in that playing wheelchair where you are sitting. And I thought next week come, the smell is still there. Now other player, now he's not coming this week, or next week he doesn't come. Now I have to put the other player in there. Does that a player pick up any symptoms of anything there of that urine that was there for almost for a week?
Yes, definitely. So it's like saying, Rolf, somebody goes to the toilet and then they pee on the seat and then you go and sit on it. Okay, you're going to pick it up. They don't clean the toilet and you go and sit on it, you are going to pick it up. Okay, so they actually shouldn't even be transferring. So I think it's something that we need to implement, where they need to check themselves before they transfer into the basketball chair. Right, because then what happens, the cushions are sitting in some dark corner gathering, whatever they're gathering, they're not clean, and then somebody else comes and then they jump on. And let's say maybe that somebody else that jumps on has a cut on their thigh, so they scrape themselves, they haven't noticed yet, and then they sit on their chair directly on that fabric. Then they're more likely going to catch an infection from it. So that's why you need to take care of your own personal hygiene so that you don't actually transfer it to everybody else. And your own chair is never really your own chair. I know that some places do share chairs. Okay, so you actually should be cleaning the chair before and after use and taking care of the cushion. So if you use the cushion and you can smell, there's a pee smell, whatever, wipe it down, put it outside, clean it for the next player. So you need to take consideration of your other players that you're playing with. And then also, if you clean yourself, then you shouldn't really be, you shouldn't really be worried about that. So what we do, I know with our patients, as soon as you're wet or you leak, we send you back immediately to the ward, go and clean. You don't get your rehab session, you're not going to get your practice session until you change out of those clothes that you're in. Because now you're sitting in a puddle of your own moisture, you're at a risk of getting an infection or even a pressure sore. And now you're going to leave our beds dirty as well, which we do clean. But rather than that, take 10 minutes, go and change your pants, check your bladder, come back. It's 10 minutes out of a 2-hour practice session. That's it. If it's your cushion that's wet, take out the cover, put the cushion in the sun, and then you can go into your wheelchair, basketball chair after you've checked yourself. So you need to be aware of your own cleanliness and everyone else around, because it is a risk case.
Thank you, Nothemba.
All right. So we got first a question from Belinda and then from Marcus. Belinda, go ahead.
Hi, thank you. So my question, I'm not even sure if it's a question or if it's just a statement from my side. So we're from Western Province and we usually take the bus to Johannesburg or Durban or whatever. And my biggest problem with that is whenever I get either back to Cape Town or if I get to Joburg, my bladder is irritated because the buses, even if they do stop, they do not stop as frequent as they should. So I'm not sure if we restrict ourselves from drinking water or is it because we can't get to the toilet the times that we should, because I mean, we're on the bus how many hours, 23 hours or less, probably almost a day. So yeah, then when we come back to Cape Town, we need to take time off because we have bladder infections just because we played a game for a weekend. So I think that there is something that doesn't quite sit well with me because a bladder infection is definitely no fun. And I do know over time, especially after having kids, women bladders, it changes because it becomes more sensitive to certain things. So yeah, that I think is mostly just a statement from my side. Yeah, something that needs to be taken into consideration for future traveling and so on.
Yeah, so yeah, you're absolutely right. The bus system is honestly not the most convenient thing for wheelchair users because one, not all buses have a toilet in them, so then you can't do your bladder program properly. Two, like you said, there's not enough stops, and even the bus company itself doesn't take you into consideration because most buses don't even have a chair to take you from your chair to the bathroom. Those small wheelchairs that fit inside the bus, because obviously yours is packed away. So yeah, it is something to be considered in terms of long travel, and whether you limit your water intake or whatever, you are going to get an infection because one is either so
another
either
question.
one, yes.
No, you can go. You can finish and then I'll ask.
Yeah, so it's because now you have all of this pee sitting in the same area for hours. That's going to be an infection. Or you've leaked and you're sitting in your own puddle of urine for hours. That's still an infection. So the infection factor you will always have if you're on a bus for 23 hours and 2 stops. So that is, that's just how our public transport works. And
Okay.
yeah.
My second question is, what way is the best way to move in a bus? Because I mean, sometimes we sit at the back, sometimes we sit in front. So sometimes I make a statement so the bus drivers will carry me around, but I know that's not always possible. And some of us, we were trained to like move on our backside forward, but I mean the buses, their floors are almost gravelly. It's not smooth surface. And then sometimes we would wear jeans. So when we travel, we need to think, okay, you need to wear something cotton or maybe a type of tracksuit pants. But I mean, like, then you have something much thinner on your backside. So when you do the whole moving thing, that's a risk. And then moving on the knees, that's also a risk. So is there something that you guys know of that we could put under ourselves or wrap around ourselves to do that movement?
In a perfect world, Belinda, I would want a wheelchair like they have in airplanes. That is the solution to that problem. That is literally the solution to that problem. Because if you sit at the back, okay, you are closer to the bottom, but that bum shuffle, there's nothing I hate more than that bum shuffle going backwards and on your knees. I hate it because it's a sheer force risk. You can wear whatever material, but you cannot scoot yourself backwards like that until you get to the back of the bus without causing some form of damage at any point. So the ideal solution is a wheelchair in a bus.
Okay,
the
but
second
can't
one
make
is
it
sitting.
happen?
Me.
I mean, no, I mean, like, as WBSA, can't we give Western Province or try and get a chair like that for Western Province, one for KZN or whoever? Yeah, so it's the club's chair. So whenever there's travel, it's our responsibility as management or whoever to make sure that the chair gets from one point to the next. I mean, I don't know.
Belinda, your
Charles come in there.
concerns are noted very clearly. Thank you for bringing this to our attention. I think that what we need to do as well is look at different modes of transport rather than a bus service, possibly equipped the Western Cape with a specific vehicle that can carry you guys where there's more frequent stops, possibly bring adult nappies into account. Let's have a look as well as some sort of catheters that can assist. But yes, thank you for bringing this to attention. We will look at this and we will definitely come with a resolution to this problem. Thank you.
Thank you.
Marcus, you've taken your hand down. Do you still have a question?
Yeah, just again, a comment going on the cushions. I think it's important that, the guys using each other's cushion, that kind of thing. That everybody uses or shares chairs. I think what we need to try to get to is a stage where at least everybody's got their own cushion. Players sit on different cushions. Somebody will sit on, say, my cushion this week. That's a lot harder. Next week's cushion might be somebody else's is a lot softer. So that also creates a lot of pressure sores or ability for a pressure sore. So as much as each player doesn't have that chair, I think it's something to look at where each player should at least have their own cushion. Just a comment there.
I think that would actually be very helpful. You're right, Marcus. It protects those, like you said, if you've got a softer cushion and a harder cushion, the harder cushions might be detrimental to your spinal cord injuries than the softer cushion would have been. So yeah, that's something I guess we can also, if we can, look into.
I'm sure, Charles, I'm sure we can look into what we can do on that side of things. Guys, sorry, Charles, go ahead.
Yeah, absolutely. I think that these sessions are extremely important, getting a lot of viewpoints from everybody. And yes, absolutely. I think it's a necessity that we take cognizance of what has been said and we try and ensure that before the next travel, everything is taken into consideration.
Awesome. All right, guys. So if there are no more questions, Yeah, again, Nothemba, thank you. It was an absolutely brilliant presentation, and I think we've all learned quite a bit. So just as a reminder, if you want to get hold of Nothemba directly, feel free to do so. You know, if you have any concerns, anything that you maybe think of that you could have asked now, and you only think of it afterwards, again, either drop us a line or get hold of Nothemba or Thobela for that matter. You know, as a result of yesterday's presentations.
Jerry, can I just?
Yeah, go, Ralph.
I want to ask Nothemba just to send us the slides of the presentation that you had, please, because I need it, because I want to have for the kids something like that. And the other thing, I just want to thank Western Cape for standing in, because I see we are the only province that is up there.
Ralphie, yeah, we can. I'll ask Nothemba to maybe share them on the WhatsApp groups for you guys and Thobela's presentation.
Thank you, Tim.
All right, guys. So after that last comment from Mr. Reynolds in the Western Cape, anybody else? Last comments. Max, last comments from you?
No, it's all sort of straightforward stuff. It's just personal hygiene, and the guys must just look after themselves. That's all.
Perfect.
And it's up to the coaches also to monitor that.
Absolutely, yeah. Any last comments there, Thobela?
No comments on my end.
Okay, cool. Thank you. Natalie from the Junior Academy side, any last comments? All good. Perfect. All right, guys. Thank you very much. We're going to end today's session.